Frequency Podcast Network. Stories that matter, podcasts that resonate.
Did Bluey lie to us? Is gentle parenting burning us out? According to a recent study, many parents who identify as gentle parents say yes, it is causing burnout and also making them question how they parent. Of course, there is no manual when it comes to parenting, but parents are navigating so much these days, from technology to financial stress to outside pressures. And gentle parenting, add that to the mix, it can be a lot. So, is there a way within modern parenting where our kids can benefit from the gentle philosophy while parents still maintain their own mental health and well-being? I'm Pooja Handa, and today on The Big Story, I'm talking to Dr. Shimi Kang, psychiatrist and best-selling author of the parenting book, The Dolphin Way. Thanks for joining us, Dr. Kang.
Thank you. I'm really excited for this conversation.
Well, I think a lot of parents are struggling. So before we get into it, can you first just explain gentle parenting and what the science says about the upsides and the downsides of it, is both for the child's development and also for the parent's well-being?
Right. Yes. So gentle parenting is kind of the latest trend in a parenting style. Truthfully, it hasn't really been empirically tested, as far as I know. There's definitely positive elements that are both common sense and very science-based, things like the use of empathy, a collaborative relationship, and obviously nothing wrong with being gentle with kids. However, when you look at the real life examples, whether you're seeing them on social media or elsewhere, there's certainly some questions there, like what happens if the child doesn't respond to the gentleness at first, then what? And also the toll on parents in terms of burnout. So I think those are all really real and important questions.
Yeah, speaking of that burnout, there was some pushback on gentle parenting. There was a peer-reviewed study that was recently published where a third of parents that they surveyed said, and they gentle parent, that they felt burnt out and that it sort of led to parent uncertainty. So is it possible that maybe gentle parenting is good for kids, but maybe bad for parents?
Well, I would say that parents and child are so interconnected. I wouldn't imagine a situation where something's not good for the parent, but good for the child, right? Because this is a dyad, this is a synergistic relationship. That study reminds me a lot about attachment parenting, which was a real rage. And what we found, again, the principles are so valid and important and evidence-based, but the practicality and the results were leading to exhausted, burnt out parents, which ultimately isn't good for the family or anyone.
Yeah, I think that's the thing, is that when you try to actually plug it into your real life, your everyday life, gentle parenting may work, but if you're in a supermarket, let's say, and your child is having a meltdown in a supermarket and you got to go, you got to check out, you got things to do, and you're still trying to apply the gentle parenting philosophy, I think it's sometimes easier said than done.
Absolutely. Yeah. And I think that also there's many, it's hard to execute for many parents. And I think there's a misbelief that it means you can never say no to your child. You can never be, let's say, firm with your child. Children do need authority. Their brains are not developed until in their mid-20s. And they do need that guidance and clear moral compass and clear direction and expectations.
So the U.S. Surgeon General issued a public health advisory about the impact of modern stresses on parents' mental health. And it cited factors like financial strain, time demands, children's health and safety, loneliness, isolation, technology, social media, as well as cultural pressures among some of the top contributors to parental and caregiver stress. So how do all those factors of stress affect a parent's ability to, one, parent, but two, to also be okay as an individual?
Oh, that's such a great question, Pooja. I think there's so many factors, like you mentioned, and the result there, the effects are really terrifying. Not to kind of be doom and gloom, but right now in North America, we are raising the most unhealthy generation of kids. And I say We are over pushing, over scheduling, overworking, yet the results are rising rates of anxiety, depression, addiction, obesity, diabetes, parent-child conflict. And in fact, the most shocking stat is this is the first generation in human history not to outlive the one that came before them. So we're definitely need to look at this question deeply and understand this moment in time. 21st century parenting is very different than what we've ever seen before.
And I'm glad you mentioned that because when we talk about technology and the stressor of technology in particular, including social media, that's relatively new for parents in the last couple decades. So, what do we know now about the relationship between children and online sites, apps, all of the stuff that comes with social media as well, both the good and bad?
Right. Yeah. Well, I'll back up a bit and talk about the effect on parents too. We know that technology has major benefits like this amazing podcast, but also major drawbacks. In my last book, The Tech Solution, I call tech the fire of our time, meaning if we understand this human innovation like our ancestors way back did, those that navigate it well will go further and farther. Those that don't will get burned and burn down the village. And we are seeing both all around us, whether at an individual level, with things like links to anxiety, depression, body image disturbance. I just gave a webinar called Virtual Autism, which is about young children who are on their screens and iPads, and symptoms look very similar. Thankfully, when you remove the screens, their social skills, their eye contact, other aspects of their behavior improves. The blue light impacting the body. So it really goes on and on. And so we have to understand that these algorithms, these platforms are designed to be addictive, and an industry that wants to sell their products. So never before have parents had to parent with an everyday embedded device or service here that has such a major impact on the developing brain, on the relationship between parent and child, and our relationship between ourselves and society. Anyone who goes around and goes into a high school or even a playground will see kids on their phones, and all of that has its impact. So that really is, I say, one of the biggest questions of our time.
And, I have young children, but I'm already thinking about whether or not I would ever give them a phone or give them access because of all of the things that we're learning. So it is interesting that one of the modern parenting stressors is also this culture of comparison because I might be the parent who doesn't want to give my kid any technology, but how is that realistic when they look at their peers? And even when they look at influencers online that sort of create this unrealistic expectations on parents of what they're supposed to do. So how can parents sort of shake free of comparison culture or this sort of competitive parenting?
Yeah, such a great question. And no doubt social media drives it. However, it is part of human nature to compare a little bit, but like everything, there's varying degrees. We know that perfectionism is on the rise, and social media is part of that. Also, a consumer based culture. So, when we are in a culture that we're constantly being marketed towards, parents are, I hate to say, like sitting ducks. So we're like gullible consumers, right? Because we all want the best for our child. And then we see an advertisement that our kid needs to be in that activity or have this, this device, or we look at someone else and, there's all this fear around it. So really understanding that perfectionism is on the rise. It's part of a bit of our human nature. We have to work against it. Social media is making it worse. There is some gender splits on that. Gender's non-binary, but we're seeing it worse in young women and girls. But really to understand that it's linked to anxiety, depression, and lower life achievement. So if you're that parent that is really proud of having, let's say, a perfect house, a perfect kids. We really want to make sure we're not imposing that and work very much against that, just like any other habit that you might have. So comparison is linked to perfectionism. These things are toxic. They release cortisol in our brain and body. And luckily, it's a mindset. It's a mental habit that can be changed.
It's also interesting when we look at parents. We just marked the 5-year anniversary of the COVID-19 pandemic, and so many things changed for us during this global pandemic. But one of the things was the relationship between people and the healthcare system. So out came this rise in being skeptical of doctors, professional medical advice, and then instead people were looking towards online forums and communities for parental advice, even for some home remedies when it comes to illnesses. So what do you make of this growing culture that sort of rejects mainstream healthcare advice and instead it turns to online spaces to get those answers or relief that parents need, where the parents are going to these places for information?
Yeah, that's so important because I feel on one hand, and I wrote about this in The Dolphin Parent, that your best parenting tool is your intuition, your human intuition. And your human intuition is actually a science. It's the right brain vagus nerve, comes from experience. And so, it is really important that if you're with, let's say, a professional or healthcare person and it just doesn't fit for you, that you truly do tap into that feeling, especially as a parent, you know your child best. But at the same time, as you noted, it has gone way too far, where we're seeing all kinds of misinformation. Influencers, some are wonderful and they're putting the information out for the good of the people. Others is the more shocking or rage farming out there, the more likes and views and followers you're going to get. So we have to understand the phenomenon behind it. And really supercharging all of that are the AI algorithms in technology that will further drive you towards that. So for example, a parent might be really innocent and say, hey, I'm going to look up vaccines. And then you can easily go down a rabbit hole. Then you'll keep getting information to support, that further decision tree. And sometimes, you're in the middle of shopping or the dentist, and the human brain is very susceptible to the information that is being they're bombarded with.
You mentioned your book, and in your work, you did discuss something called dolphin style parenting. So, can you first explain what that is and also how adaptable dolphin parenting it is to various cultures as well?
Right. Yeah. So I'm a psychiatrist. I've been a psychiatrist 25 years. I'm a neuroscientist. I'm a parent of 3 kids, 3 teenagers, and worked with all kinds of families in my life. And when I wrote that book, The Dolphin Parent, there were all kinds of parenting metaphors of what not to do or what was going on. There was tiger parenting and snowplow and helicopter. And I'm like, there's really nothing that is based on science and common sense. So that was really the premise of writing that book. And there's 365 references for the 60 prescriptions in there. So dolphin parenting really is the science of parenting. And when we step back, there's generally 3 parenting styles. And this is true for interpersonal styles. You can either show up in your relationships as, on one extreme, I call it the jellyfish style or permissive parenting. At the time, the attachment style, or maybe now the gentle parenting style, kind of fit in there at times where you're overly permissive, lacking boundaries, lacking expectations, lacking rules. And that just doesn't work. When you look at outcomes, those kids have higher risk taking, less self-motivation, less healthy kids in general. So on the other extreme would be the authoritarian style of parenting. It could be tiger, helicopter, snowplow, shark, whatever you want to call it. And again, that's too many expectations, micromanaging, hovering, controlling. And those children lack creativity, critical thinking, self-motivation again. And so the balance between those two is authoritative, or you can remember dolphin, right? So don't be a jellyfish, don't be a shark, be a dolphin. Think of the body of that animal. It is firm yet flexible. So there is a balance between being firm and yet being flexible. It is guiding, not directing. It is collaborative, but you are still clearly an authority, a guiding moral compass in your child's life. So that's the relationship. And then it's accompanied by a lifestyle that values 3 key things that are really important for the human brain and 21st century kids are missing. These are play, sense of connection with others, or downtime. So POD is the pod, play others, downtime. So it's an interpersonal relationship with three key activities valued in the lifestyle.
Okay, so you've just mentioned a couple different sort of parenting styles. We're also talking about balance. So if we combine the two here and we talk about what parents are trying to do when they're finding balance between whatever that parenting philosophy may be, but then also trying to make sure that they're raising resilient, well-adjusted children, all while trying to also prioritize their own health and their own well-being. What's your advice there?
Yeah. So, my first prescription in the Dolphin Parent is to breathe and just self regulate. So, we are running stress is the number one health epidemic of the 21st century. I worked at the WHO years ago in Geneva, Switzerland. I was part of that research. The next major health epidemic is loneliness. So, we have to understand parents are trying to parent in high stress, high isolation environments. This puts the parent's brain into a reactive state of freeze, fight, or flight. For parents, freeze is controlling behavior or anxiety, micromanaging, right? Like that little blue circle, we get obsessive, we go round and around. We think of something that really ultimately probably doesn't matter in the long term. We fight not only with our kids, but with our spouses, with society in the sense we get over competitive. Or we flight, and meaning any form of mental distraction, right? So we get too busy, we check our phones ourselves, we sign up for way too many activities, we're distracting ourselves. So really to understand, we don't want to parent from that reactive state, yet there's no vaccine or immunity to these number one health epidemics, loneliness and stress. So really, we want to learn to self-regulate, right? When the parent practices the pod, when the parent practices their downtime, their connection with others, at play mindset, meaning being comfortable with their own mistakes, trying new things, not being a perfectionist. Now you've created an environment in which your child can flourish.
That was wonderful. Thank you so much for joining us today, Dr. Kang. And for more information on Dr. Kang, you can head to drshimikang.com. That was The Big Story. You can send us feedback on this episode or any other episode by emailing us at hello@thebigstorypodcast.ca or leave a voicemail at 416-935-5935. You can find us on the Seeker app or on all your favorite podcast players. Please rate, review, and follow and share. I'm Pooja Handa. Thanks for listening.